This is one of the very important remedy for respiratory complaints, especially the dry type of cough, hacking type of cough, which is so severe mainly in the evening time, which compels the persons to wake him up from the sleep, and only better by sitting, and aggravation by lying down, and aggravation by inspiration. This is not rustox, this is not spongia, this is not bryonia. This is also very important remedy for allergic manifestations like allergic rhinitis or allergic conjunctivitis. There is severe itching, constant sneezing, less of discharges. This is not allium cephas, this is not euprasia, this is not arundo, this is not ambrosia. This is also very important remedy for the females who have got scanty breast milk. This is not to lack defloratum, or this is not Ricinus communis, or this is not asafoetida. This is also very important remedy for rheumatic manifestation, rheumatism of the right shoulders. The rheumatic manifestation with a severe inflammation, full of redness, swelling, and rheumatic complaints and respiratory complaints alternates. Sometimes the sneezing, sometimes rheumatic complaints. It's also very important remedy for the person who have the feeling as if she or he is floating in the air. This is not lac caninum, or this is not lycopodium. It is also very important remedy for housemaid's knee. The knees are swollen and red. This is not rustox. This is a remedy prepared from the fungi, so-called algae, called Sticta pulmonaria.
Sticta Pulmonaria. This is one of the very important remedy for catarrhal conditions, nervous conditions, and rheumatic affections. This drug belongs to the group of fungi or algae, belongs to the order of lichens, which is commonly known as lungwort or lung moss. The word sticta is derived from the Latin word. Sticta means a spotted. As you can see, in the plant has got full of spots. Pulmonaria, because this algae or this fungi, which resembles to the shape of human lungs. Because this algae or this fungi resembles to the shape of human lung, and also it is very effective in the various elements of lung diseases. Because of that, it receives the name as pulmonaria. Regarding the habitat, this plant grows on hilly areas, especially on the trunks of the large trees in the mountain countries like England. This is a fungi which grows on other plant or which grows on other tree. Mother tincture is prepared with the ratio of 1:5. A fresh lichen grown of the sugar maple tree which has been collected and triturated, and medicine is prepared as per the pharmacopoeia. This drug or this medicine, Sticta pulmonaria, is first introduced by Dr. Hale into the field of homeopathy for various catarrhal and cough conditions. Later on, it has been proved by Dr. S.P. Burdick, Dr. C.H. Lutz, Dr. Samuel Lilienthal in the year 1864. This is the short introduction about Sticta pulmonaria. Sticta pulmonaria is also known as a lungwort or lung moss, which found growing on the trunks of large trees in the mountainous countries, especially in England. This is a algae or fungi which grows on other trees, barks of the trees or trunks of the trees. Lungwort is widely distributed throughout the world, presently in Europe, North America, Africa, and Asia. Especially grows in damp places. There are several other common names for Sticta pulmonaria other than lungwort, lung moss. It's also known as tree lungwort, lung lichen, lung moss, oak lung, oak lichen. Like that, it has got several common names. As you can see in the image, the moss or the lichen or the fungi, which is green in color, the surface is leathery and it has got a peculiar lobulated appearance, typically which resembles that of human lungs. It has got a pattern of ridges and some depressions on the upper surface of the fungi. It has got some hairy portions also seen. A spotted lichen which grows on the trunks of large trees, specially prepared from the lichen which grows on sugar maple tree, because this lichen which resembles to the shape of human lung. That is the peculiar doctrinum of signature of Sticta pulmonaria. It has been used in various lung ailments by the various tradition medicines. There is lots of cures happened by using this remedy as a decoctions in olden school of treatments. Sticta pulmonaria not only been used as a medicine in the olden school, but it has also been used as a food substance. It has been also used as an ingredient to prepare the beer. It has been also used in the manufacturing of perfumes, to produce a orange dye for the wool, and also for leather tanning. Lungwort has a long history of being used as an herbal medicine, especially for various lung ailments such as bronchial asthma, tuberculosis, pneumonia. It is also been used in the treatment of eczema and hemorrhagic disease. Through the scientific investigation and scientific study, it has been found that it has got an antiseptic property, it has got an anti-inflammatory property, it has got an anti-proliferative property, gastrointestinal protective property, and antioxidant activities by doing the study on rats. Sphere of action of Sticta pulmonaria. As the name suggests, pulmonaria, this drug has got marked action on the respiratory system. It has got action on the nervous system. It has got action on the mucous membranes of nose, chest, bronchi. It also has got action on the joints, muscles, especially has got action on the right shoulder. It is not a deep acting remedy. This is most of the time an acute remedy. We don't have much of the symptomatology, and very few textbooks of Metromedica has got indication of Sticta pulmonaria. This is generally an catarrhal remedy. It is generally a nervous remedy, and this is generally an rheumatic remedy. So specially adapted to the people who are prone to have a catarrhal complaints, people who are prone to have a nervous complaints, people who have a rheumatic complaints. Every now and then, most of the time, the catarrhal and rheumatic complaints alternate with each other. For them, this drug is specially adapted. We'll see quickly some of the keynote indication or practical indication of Sticta pulmonaria. The most important indication in the practice regarding the Sticta is it is indicated for cough. It has been first used by Hale in his practice in the treatment of cough. The characteristic of cough is severe harassing cough. The most of the time cough is very dry. The cough is aggravation towards the evening and aggravation towards the night. Person can neither sleep nor he can lie down, he must sit up. That is a peculiarity of cough. The severe harassing cough, especially in the evening time and night, he is unable to sleep up, he is unable to lie down, and he must sit up. Again, peculiarity of this cough is aggravated by inspiration and aggravation, especially cough after measles, like that of sanguinaria. Now you may be asking, why we need to think Sticta as a remedy for cough? We have got several other remedies for the cough like Bryonia, Spongia, Rumax, Pulsatilla, Drosera, Stanometallicum, Cuprometallicum, Justitia odorata. So like that we have got several drugs. Now how to differentiate cough of all this drug? So Bryonia is a remedy which is very effective where the cough, especially when there is a change of weather, when the days are hot and nights are cold. Cough maybe after a watermelon in Bryonia. Cough, most of the time there is a dry cough. Slightest movement is aggravation in Bryonia. Person is be holding the chest while coughing. That is a very peculiar sign of Bryonia, associated with maybe headache, associated with maybe fever, maybe associated with constipation, where a person will have a thirst for large quantity of water. There you can think of Bryonia. Regarding the spongia cough, which is again a dry cough with a peculiar sensation as if a saw is being driven to the throat, as if the person is breathing through the pipe, like that cough. Dry, barking and croupy cough. There's a hoarseness of voice. And again, we know spongia is aggravation by eating sweets. The sweets causes cough. Aggravation lying on with head low position, that causes cough. Regarding the Pulsatilla is again a very important drug. Again, change of weather. Most of the time the Pulsatilla, maybe a constitutional features will be there. The person is having a thirstlessness associated with the nose block, the yellowish discharges, and towards the evening is aggravations, and person is keep on crying. Maybe person is very mild and gentle. That will help us to differentiate Pulsatilla from other drugs. Regarding the Rumax cough, especially the cold breeze causes cough. Aggravation by cold air, aggravation by touch, even touching the pit of the throat provokes cough in Rumax, and they only feel better by warmth and covering off. Slightest breeze, especially cold waves or cold weather, creates cough. There you can think of Rumax. Regarding the Drosera is again a kind of woofing cough, a dry barking cough, a spasmodic cough as soon as the head touches the pillow, as soon as the person lying down cough. Drosera, peculiarity of Drosera is more of tubercular background, and you cannot repeat Drosera single dose, you need to wait and watch. Regarding the Stanometallicum, again we know that Stanometallicum is more of a pneumonia related, a dry spasmodic cough, a cough in 3 paroxysms, where you can think of Stanometallicum. Justitia odorata, it's a very peculiar cough, most of the time allergic cough, and it has been peculiarly described in most of the textbook that no death can happen if you prescribe Justitia odorata for the tuberculosis or allergic conditions or respiratory affections. That is how you can differentiate Sticta from other drugs. Sticta, the cough, more of dry, especially in the evening and night. He cannot lie down with the cough. He must get up and he must sit up. That gives him amelioration and aggravation on inspiration. The second indication of Sticta is regarding the coryza, which is again more of hay fever like symptom, more of allergic coryza. There is a violent sneezing associated with headache and conjunctivitis. You can think of this remedy for allergic rhinitis or allergic coryza or hay fever. You can also think of in atopic rhinitis like that of Sabadilla, associated with burning in the eyes and burning in the eyelids. Now again for the coryza we have got several drugs like Allium cephas, you have got Euphrasia, you have got arsenic alb, you have got Natramur, we got Naxomica. Now when to think of Sticta? Sticta you must think as a remedy for coryza whenever it is associated with allergic manifestation, associated with dry cough, associated with rheumatic manifestations. Now, how to differentiate Allium cephei, Euphrasia, Arsenical, Naxomica, Sabadilla? Allium cephei, we all know that in coryza, the acridity of discharge, acrid coryza and bland lacrimation, that makes Allium cephei. Opposite of that is Euphrasia. Coryza is bland and acrid discharge from the eyes. Arsenical is again, we have many symptoms: restlessness, burningness, and thirst for sips of water, along with marked weakness, prostration, and anxiety, which makes us to think of arsenical. Naxomic is again more violent, more irritability along with that, and aggravation in the night, aggravation early morning, and it is not just one sneezing, constant sneezing, which you may think of Naxomica. Now we have other drugs for hay fever like Ambrosia, Arundo, Muritanica. We have got Vietia. So how to differentiate Ambrosia? Ambrosia is again a remedy for coryza, hay fever, associated with itching in the eyelids, and there is a tendency for nosebleed. Regarding the Arundo is again a remedy for hay fever, especially there is itching of the palate or roof of the mouth, associated with the itching from the eyes, there is itching of the nostrils, along with there is a coryza, person will have a loss of smell, where you can think of Arundo. Then we have a Vietia, which is again a remedy for pharyngitis associated with itching in the palate. So like that we have got several drugs. You can think of Sticta whenever there is a allergic manifestation associated with rheumatic complaints. Another indication of Sticta pulmonaria is regarding the rheumatic pain. The rheumatic attacks where precede the catarrh or followed by rheumatic pains, the catarrh will start. Whichever it is, either the catarrh will follow rheumatism or rheumatism will follow catarrh, which is associated, or sometimes the rheumatic complaints and catarrhal complaints may alternate. Associated with swelling of small joints, there's rheumatic stiffness of the neck, there's a pain in the shoulder blades, associated with restlessness of hand and feet. For the rheumatism, we have got several drugs like Actiresimosa, Colchicum, Rustox, Ruta. Each drug we need to differentiate. Regarding the Actiresimosa, we know that this is a remedy, Actiresimosa. There is a shifting type of pain. There is especially the rheumatism around the neck muscles. There is a sharp electrical lancinating type of pain. The pain shift from place to place, associated with maybe in uterine complaints, where you can think of Actiresimosa. Along with that rheumatism in Actiresimosa, they also have a chorea and jerking movements that makes it to differentiate Sticta from Actia. And Colchicum is again a remedy for rheumatism, especially of the knee joint, where the knee joint is effusion. There is a kind of swelling about the knee joints, associated with uric acid diathesis, associated with heart complaints. There's a pain in the, especially pain in from left to right side moving, you can think of Colchicum. Next indication of Sticta is regarding the dryness. Everywhere dryness. There's a dryness runs throughout this remedy. The catarrhal discharges are dries up so quickly and it forms a crust. It is very difficult to blow out. The person is constantly blowing the nose, but no discharge comes. Within few seconds or within few minutes, the discharge it turns into a crust, like that of pulsatilla. So the person is constantly sneezing, person is constantly blowing the nose, but there is no discharge. That is a peculiarity of Sticta pulmonare. Discharge comes on account of dryness. There is an excessive painful dryness of the nasal mucous membrane. The soft palate felt like it is a dried leather, like that of Nux moscata. We have got several other drugs for dryness. A very important drug is Nux moscata, which is again a hysterical remedy, a nervous remedy. Here, peculiarity of Nux moscata, the saliva looks like that of a cotton, that much severe dryness. Bryonia, we know that it is a very important remedy for dryness. Dryness from mouth to anus, you see in bryonia. Alumina is again chronic of bryonia, there is again a dryness, the dryness of the mouth, the dryness of the throat, and the person is have a tendency for constipation associated with the dryness, you can think of alumina. Belladonna is again indicated for dryness associated with inflammation. Next indication of Sticta pulmonaria, which is very similar to that of lac caninum. Feels as if the person is floating in air. A sensation as though the legs are floating in the air. The sensation as though legs are not touching the ground. As if she wanted to fly away, which is a peculiar mental symptoms of Sticta pulmonaria. We have other drugs like lac caninum. Lac caninum is very easy to differentiate from Sticta. Lac caninum is again a deep-acting remedy which has got many of the symptoms. A very peculiar of lac caninum is marked forgetfulness or marked weakness of memory. That will make us to differentiate lac caninum from Sticta. Sticta, you don't have such symptoms. Again, datura, also the person is have a tendency as if the person is floating in the air. Datura is associated with delirium. Here we don't have a delirium, here we don't have forgetfulness, but person have a sensation as the legs are not touching to the ground, as though person is flying or the person is floating in the air. Another indication of Sticta pulmonaria is regarding the headache. This is mostly a catarrhal headache. There's a dull headache or catarrhal headache, especially at the root of the nose. There's a kind of pressure at the root of the nose, a kind of pressure in the forehead. It is mainly associated with catarrh. Mainly headache before the discharge appears. As we know that in Sticta, full of dryness, so there's no much discharge as comes out from the nose. The noses are crust formation, so blockage of discharge which leading to a headache. So catarrhal headache, you can think of Sticta pulmonaria. Again, we need to differentiate this remedy from Calibachromicum. We need to differentiate this remedy from Naxomica. We need to differentiate this remedy from Natromure based on other constitutional features. Sticta pulmonaria is also indicated for housemaid's knee, especially the females who are constantly cleaning the floor, people who are bending and touching the knee on the floor and getting the joint pain. For them, this remedy is indicated. That is why it's called as a housemaid's knee. They have severe shooting type of pain in the knees. The joints and neighboring muscles are red, swollen and highly painful. We've got several other drugs for housemaid's knee. The remedies like Rustox, Kaliioidatum. Rustox has got a vast number of symptoms to differentiate, which is a well-proved remedy. Aggravation by first movement and better by constant movement, which is a peculiar modality where you can think of Rustox. Especially the complaint starts during the rainy weather. Complaints associated with vesicular eruptions, a red triangular tip, and other many symptoms we can differentiate Rustox from Sticta. Kaliioidatum is again an antisyphilitic remedy, especially indicated for degenerative joint diseases where the midnight aggravation and the night is aggravations, which will help us to differentiate Kaliioidatum from Sticta. Sticta is just a remedy for housemaid's knee. We don't have much of the modalities. There is a shooting pain, the joints are inflamed, red, swollen, the muscles are painful. That is the indication of Sticta. One more indication of Sticta is regarding the talkativity. Person must talk, whether you listen or not. There's a great desire to talk about anything and everything. Doesn't care whether anyone listens to her or anyone listening to him. Cannot keep her tongue still. Very lively and always wants to talk. And we need to differentiate this remedy from our great lachesis, Stramonium, Agaricus. Lachesis, Stramonium and Agaricus has got many other symptoms, vast number of symptoms to add on to differentiate this remedy from them. Lachesis person jumps from topic to topic. Stramonium is more of maniacal manifestation. That's how we can differentiate Sticta from other drugs. Sticta is also indicated for diarrhea. The characteristic of the stool is very profuse and frothy, especially diarrhea associated with loose cough, aggravation in the early morning. There are several drugs for diarrhea. Definitely we will not think as a Sticta as the first choice of remedy. We have remedies like LOs, we have got remedies like natrum sulf, naxomica, arsenic alb, gambogia. There are more superior in action in diarrhea as compared to Sticta. But Sticta, we should not forget, when diarrhea associated with catarrh, when diarrhea associated with rheumatism and joint affections, you can think of Sticta. It is also indicated for scanty breast milk of nursing women. We have several other drugs for scanty breast milk. The remedies like lac defloratum, remedies like asafoetida, there are remedies like Ricinus communis. All those drugs act wonderfully if you prescribe a single dose, and not to repeat. Lac defloratum 200 or 1 ml single dose, or Ricinus communis 200 single dose. We need to wait and watch. Just opposite of that, to dry up of the breast milk. There are excessive breast milk formation and patient wants to dry up. Then you can think of lac caninum and also bryonia. Sticta is also indicated for pulsation, especially pulsation on the right side of the sternum to the abdomen. There is a peculiar pulsation, person feels there's some kind of pulsation in right side of the sternum to the abdomen. For the pulsation, we have got several other drugs like lilium tigrinum, belladonna, glonine, sulfur. Each one we need to differentiate with other constitutional features. Sticta pulmonaria is also indicated for inflammatory rheumatism. We have several drugs for rheumatic affection, but characteristic of Sticta is more of inflammatory. The affected joints are full of warmth and heat. It has got circumscribed redness of the affected joints and muscles. Rheumatism of the right shoulder, rheumatism of the deltoid muscles, rheumatism of the biceps. More of inflammation, they have a spots of inflammation and redness of the affected joints. We need to differentiate Sticta from other commonly used rheumatic remedies like ledum-pal, rhododendron, abrotonum, rustox, actiracemosa. Coming to the ledum is more of ascending rheumatism, the rheumatic affection which starts from the foot, ankle and ascends upward. There is a tearing and throbbing type of pain you get in ledum-pal, aggravation by slightest movement, night and warmth, and only amelioration by icy cold water application. That is a very peculiarity of ledum. The rheumatism which is relieved by applying icy cold water, that is the uniqueness of ledum-pal. Again in ledum-pal has got a diagonal pain. There's a left shoulder and right hip affection and more of ascending in nature. That is a peculiarity of ledum. We don't have such symptoms in Sticta pulmonaria. In Sticta, rheumatism associated with catarrh, rheumatism associated with coryza. That is the indication of Sticta. Coming to the abrotonum. Abrotonum is again a remedy for rheumatism, which is again a ascending rheumatism where the person is more of emaciated. The rheumatism comes after suppressed diarrhea or after suppressed discharge, or diarrhea and rheumatism alternates. Again, rheumatism associated with hemorrhoids, you can think of abrotonum associated with exudation of the joints. Regarding the rhododendron, slightest change of atmosphere, slightest change in weather creates a joint pain. That is an indication of rhododendron. We'll try to learn some more deeper indication of Sticta pulmonaria regarding the respiratory complaints, which is very similar to that of Calibicromicum. Person feels a kind of fullness at the root of the nose, as that of Naxomica. Feeling of fullness and heaviness at the root of the nose. Indicated for atopic rhinitis. There's a marked dryness of nasal membrane. Person is constantly blowing the nose, but there is no discharge. He need to blow the nose till he get discharge, but discharge is very scanty. It's almost dry. There's a tendency for a scab formation around the nostrils. These respiratory complaints are aggravation in the evening and the night. Indicated for hay fever, where the person is a constant sneezing that you see as if in Sabadilla. The throat feels very raw. There's a drooping of mucus posteriorly, as you see in Calibichromicum and pulsatilla. There's a tendency for hacking cough, dry hacking cough, especially in the midnight. He is unable to lie down, he is unable to take rest, he has to get up and sit, then only the cough is better. Worse by inspiration, indicated for tracheitis. There's a loose cough in the morning. There's a pain and pulsation around the right side of the sternum, which descending down to the abdomen. Cough mainly after measles, as you see in sanguinaria. The cough is again dry, aggravation in the evening, and the person is so much tired. This is the indication of Sticta pulmonaria. It is more of allergic symptoms you can see, more of allergic you can think of in clinical condition like allergic rhinitis or hay fever or atopic rhinitis or bronchial asthma or bronchitis. More of allergic bronchitis you can think of Sticta, associated with rheumatic complaints. Let us quickly summarize the indication of Sticta. As we said, it is indicated for cough, more of harassing cough, more of dry cough, which is in the evening and night. Cannot lie down, he must sit up and breathe, then only the cough is better. And cough is aggravation by inspiration. Then we said it is indicated for coryza or hay fever, where the person is having a violent sneezing associated with headache and conjunctivitis. Then we said that it is indicated for dryness. The nasal discharge dries up so quickly and leading to a crust formation. Person is constantly blowing the nose, but there is no discharge. There is a peculiarity of Sticta. Then we said it is indicated for rheumatic pain, which is either rheumatism precedes the coryza or rheumatism follows the coryza. Associated with redness, stiffness and swelling of the affected joint. And we said that Sticta is also indicated for the person with a sensation as if he or she floating in air. It is also indicated, we said that it's a remedy for dull headache, more of catarrhal headache with a pressure-like sensation at the root of the nose with posterior nasal discharge. Sticta is also indicated for housemaid's knee, associated with the shooting pain of the knees, and the affected knee joints are swollen, red and inflamed. Again, we said that Sticta person is constantly talking. Whether you listen or not, the person is constantly talking and cannot keep her tongue still. That is the indication of Sticta. And we said the Sticta is also a remedy for diarrhea, also a remedy for scanty breast milk, also a remedy for pulsation, especially on the right side of the sternum to the abdomen. This is in short about Sticta pulmonary indication. Regarding the modalities, aggravation by sudden change of temperature. Aggravation is night, especially the cough is aggravation in the night. Aggravation lying down. Motion is aggravation. And change of weather or change of temperature is an aggravation for Sticta. And amelioration by free discharge and also amelioration by open air. We need to compare other remedies, Rustox, we need to compare Ruta, we need to compare Ledum, we need to compare Calioidatum, we need to compare Arundo in hay fever, we need to compare Ambrosia in hay fever, we need to compare Rheumatia in allergic manifestation. Regarding the rheumatic complaints, you need to also consider Simsifica.